Okay, so we're gonna be looking at stakeholders analysis. So we're gonna be looking at three stakeholders. So the three stakeholders that we're gonna be looking at is nurses, doctors, and management. So when it comes to nurses, the requirements for them for this project are to be able to implement any new policies and be able to actually participate in meetings that have to do with this quality improvement change and be also able to participate in the learning workshops that's probably going to be happening. In addition, what the project needs from the stakeholder is to motivate other staff into implementing these new changes, to motivate other staff and remind them, oh, remember to use the scale, or remind doctors, now we're using the drape. So this would help advance the project. Then some type of attitudes or risks that we could be facing with nurses are that a lot of nurses have their routine going already. They're not used to weighing the pads, or they're not used to telling the doctor what is your actual qualitative blood loss rather than your visual one. So a lot of them will have probably a resistant attitude. um, Action that we could take is having them attend annual mandatory education workshops, or also having them keep up with evidence-based practice regarding postpartum hemorrhage, and just basically have them stay updated when it comes to information based on that topic. Now for doctors or OBGYNs or anesthesiologists, they are gonna be working in this unit regarding postpartum hemorrhage. Requirements for this project from them are to be able to support the staff and implementing the correct protocols during delivery, as well like the nurses, like how I said, making sure that not because they want to hurry up and do the delivery, they're not using the drape and they're just telling them the visual estimation, but rather actually placing the drape under the patient before the delivery, or using it in the C-section so that they're able to actually have a qualitative blood loss. What the project needs from doctors are to be patient with staff and all new changes of facilities. Sometimes doctors forget if there's new policies because they go to different um, hospitals. So basically, be patient with nurses because maybe this is a new change. It takes them a little more while to set up the patient. Some attitudes or risks that we could be facing with doctors are doctors getting frustrated with staff again because there's new changes being implemented. Also, changing their typical routine of vaginal deliveries, not just doing the visual estimation anymore, but now they actually have to give you a calculation, or make sure the nurse knows. Some actions that we could take is help them become familiar with the hospital's policy. Like, oh, hey, now we're doing this, doctor, by the way. And they should continue also to educate their patients on postpartum hemorrhage, on things that patients need to be aware of. When we're talking about management, clinical managers, and everyone, CEOs and everyone related to us, the requirements we need from them for this project is to able to support any new evidence-based practice project that is related to postpartum hemorrhage. In addition, we want them to be open to with staff feedback based on the project, not just implement it, but also listen to what they want. One of the things that the project needs from management is to be willing to financially support them, be willing to provide, because it's going to need a lot of implementation when it comes to scales, to drapes, um, basically financially, and support the whole project through the whole thing, not just through the beginning. Attitudes that we could see in management, and they're not deeply invested in it. They just say okay, but actually supporting the unit. Another an action that can be taken by management is putting in place actual internal policies and procedures for all staff to follow.